And I are very excited to introduce Dr. Lisa Campo Engelstein, who is the director of the Institute for Bioethics.
You guys, or I'm sorry,
Humanities.
you. Bye.
Please mute. Please mute. Director of the Institute for Bioethics and Health Humanities and the Harris Kempner Chair and the Humanities in Medicine Professor at the University of Texas Medical Branch. Dr. Campo Engelstein specializes in reproductive ethics, especially fertility preservation, male contraception from a feminist and queer bioethics perspective. The BBC recognized her research as engendering a better future for women, naming her as one of the 100 inspiring and influential women of 2019. She's been a member of the Oncofertility Consortium since its inception and is presenting on behalf of the Humanities Committee of the Oncofertility Consortium on the ethics and legality of posthumous reproduction. She has said that she will speak for a while and then take questions, and you're free to either put the questions in the chat and I will read them to her, or to unmute yourself and ask a question. Thank you very much. I'll turn it over to you, Lisa.
Thanks so much, Gwen. Thanks to everyone at the Oncofertility Consortium for having me, and the Humanities Group, which Dr. Quinn has chaired, which appreciate you having me here today. My pleasure. So let's jump right into what we're doing. Our objectives is to look at what are some of the legal rights of posthumously conceived children. I'm going to be focused mainly on the US, but I will talk about some other countries as well.
Sorry for you.
To discuss the benefits and harms of posthumous assisted reproduction. I'll sometimes just call it PAR for short, because it's too long otherwise. Describe why written consent is often the most ethically acceptable, because it upholds the autonomy of the deceased, and look at why we treat it differently when a partner or spouse requests posthumous assisted reproductive technologies than some other groups. So that's what is on the docket for today, and I don't have any disclosures. Okay, so let's give some background on this. First off, this is something that's happening in the news. You may have seen this case a couple of years ago. Tragic case of a young man who died during a ski accident. I was actually living in upstate New York at the time, and that's where the accident took place. He was declared brain dead, and his parents requested sperm retrieval. So the New York Supreme Court granted the request 2 hours after it was filed. This is obviously time sensitive because he was brain dead and they wanted to remove him from life support. So they said, we'll freeze it for now, and then it can go back to court and we can decide whether or not his parents can use it. And in the end, the court later ruled that they can. I tried poking around to see if they've used his sperm or if I could get any updates. I can't find any. If you have updates, please let me know. I'd love to hear. Okay, so what is PAR? I want to make sure we all are using the same definition here. It's when we use assisted reproductive technologies to conceive a child after one of the genetic parents have died. So someone who is contributing genetically. And there's two types here. One in which the individual already has reproductive material frozen, eggs, sperm, embryos, testicular or ovarian tissue. And the other case where the individual does not have anything frozen. And these raise different ethical considerations. So let's look at these in turn. So for a person who already has it frozen, what might that look like? Well, people sometimes freeze their gametes before cancer treatment, as we well know, oncofertility, before gender affirming care, military deployment, or age-related infertility. So there might be reasons why people already have banked their reproductive material. Sometimes if people are undergoing IVF and they've created embryos, they may have extra embryos that are in storage. And there are different ethical claims when we're talking about embryos, which have the genetic material of 2 people, as compared to gametes, which only have the genetic material of 1 person, right? And we'll walk through some of that as we go. Okay, so retrieval of gametes. This second type, where someone doesn't have any frozen material, often what happens, as in the case of Peter Zoo, is the family wants to retrieve the gametes from a patient who usually is terminal and lacks capacity. Typically, this is done for cisgender males because sperm retrieval is easier than egg retrieval, although we have seen some cases where people are requesting egg retrieval. And also, if you have a cisgender heterosexual couple, you have someone who can gestate the pregnancy, which is sometimes a concern if you're removing eggs and you don't have someone who can carry that pregnancy. Okay, so let's look at some of the legal and policy considerations. And let's look at legality. So I have some Western countries here where it is illegal. Posthumous reproduction is illegal. In the UK, it is legal when the man has given written consent, so it must be written down. It's legal in the US and Israel, but in the US, it varies depending on the institution. Some institutions have policies, some do not. Actually, many do not, unfortunately. So, what are the rights of posthumously conceived children? Well, in the US, it really depends on the state law, and it depends on where you're living. So there was a case from the 80s in California where the judge ruled that a posthumous child could receive inheritance. But there was another case a couple decades later where in Massachusetts where they said they could not receive benefits. So really, it's very dependent upon the state. So let me give you some examples of this. And I know this has a lot of text here, but I want to tell you this story of this family because this case went all the way up to the Supreme Court, and it was the first oncofertility case. So we have Robert and his wife, Karen. He was diagnosed with cancer, and so because he was diagnosed with cancer, he decided to freeze his sperm. He and his wife conceived a child, the one next to her in the white dress there, via sexual intercourse, and then he died. And they had this sperm frozen, and they always wanted their son to have siblings. So she used that frozen sperm and gave birth to the twins with the blue arrow right there. So she applied for Social Security survivor's benefits based on her husband's earnings during his lifetime. And they had tried to plan ahead. They had a notarized statement that any children, quote, born to us who were conceived by the use of our embryos shall in all respects be their children, entitled to their property. This was a notarized statement. It was not in the will. So what happened here? Well, it went to the state of Florida and they rejected it because of state inheritance laws in Florida. So Karen appealed this, and a decade ago, it went all the way to the Supreme Court, and the court ruled unanimously that the children were not entitled to the benefits based on state law. So if there was a different state that had different laws, the outcome could have been differently, but they were saying this is a states' rights issue to decide this. So what does this look like? What's the landscape in the US? About 20 states allow PAR children to receive inheritance. I moved to Texas about a year and a half ago, and Texas is one of the states that does allow that. So it's important if you are living in the US to look state to state. But what do our professional societies have to say about this? Well, ASRM and ESHRA both have issued ethics statements on this. So the American Society for Reproductive Medicine and the European Society for Human Reproduction and Embryology. And it's important to recognize that although they have these statements, they're not legally binding. These don't necessarily have any teeth. These are just guidelines, especially in the US. And there is a concern that providers aren't familiar with these statements, or if they are familiar with them, that they're not necessarily following them. So even though we have these statements, we have some guidance out there, doesn't mean that people actually are aware of it. And this is a project that I was fortunate to be an author on with Dr. Quinn and some other wonderful folks here, where we asked people in the US, do you have a policy regarding posthumous reproduction, specifically for embryos and oocytes? And what we see here is close to 60% said they did, and just over half said they've used the policy. And for those who didn't, about 60% also said they've considered adopting a policy, but still don't have one. So a good number of clinics in the US don't have a policy, but we do see that the number, thankfully, is decent. It's growing. Okay, so let's turn to these 4 bioethics principles that you love and loathe both to assess some of the ethical considerations when we're talking about posthumous reproduction. So the first one I want to talk about is justice. And often when we're talking about ethics and justice, we're talking about allocation, and is allocation fair? And is PAR available to everyone? And the answer is clearly no. Do you have materials already frozen? And if you don't, are you at a facility where they will do this type of procedure? I worked at a hospital where there was no one on staff who would retrieve gametes posthumously. And so even though the family wanted it, they weren't able to do it because they weren't able to get any clinicians to do the procedure. Another justice question is this a good use of resources? We have infinite needs and limited resources. So how do we decide where we should spend our money? Is this where we should be spending our money, or should we be spending it elsewhere? And right now, without strong guidance, it's kind of a free-for-all. I mean, sometimes people jokingly refer to the US reproductive landscape as like the Wild West because the rules vary so much from place to place, and often there aren't firm guidelines as there are in many European countries. So I'm going to treat non-maleficence, do no harm, and beneficence together, do good. And so we need to look at what are the benefits and harms to various stakeholders, and we'll cash this out as we go through. So the individual who's deceased, right? The partner of the deceased, if they have a partner, the children who may be created posthumously, and then the family of the deceased more broadly, as well as society. What are the implications on the societal level of PAR? And then the big question here is autonomy. So the deceased, did they consent to this, right? Is this something they would have agreed to if they don't have anything written down? What about the partner of the deceased? Do their rights depend on whether it's gametes or embryos that are frozen? We talked about that they are scientifically different, and that leads to different ethical considerations. The children who are created posthumously, the parents again, do they have a right to their genetic material? So assuming that this child is genetically related to them, that's their genetic material as well. Does that give them any special right to that genetic material or no? So we're not going to be able to answer all of these questions, but we're going to try to address them. Let's start with, did the individual consent? And, especially when we're talking about heavy topics like posthumous reproduction, I like to throw in a little bit of humor here. So the first question is, would the deceased consent to it? And we need to distinguish here between written consent, where someone has written this down and said, this is what I want, and implied consent, where we're just making assumptions based on what we know about the person. So I couldn't resist another cartoon. This one cracks me up.
Oh, yeah, you did, but
So
I wanted to.
written consent, we know clearly upholds someone's individual autonomy. They have documented what they want. They have said, this is what I want in this scenario. So people feel more comfortable moving forward. And ESHRA, in fact, only allows PAR when there's written consent. ASRM says written consent is best, but it does allow for implied consent. So there is a consensus out there that written consent is the best option because we know we're upholding the person's autonomy. So although sometimes you might think, well, ethicists never agree on anything. We do agree occasionally, and this is one of the places. So let me share another case with you. This is a case of a man who's froze his sperm, and he said in his will that he wanted his girlfriend to inherit his sperm. He then died by suicide. And I have this quote here by him and a picture down here. He froze 15 vials of sperm. He said he's been assiduously generating frozen sperm samples. No kidding, 15 samples, wow. And so the hope here was that he would be able, his partner would be able to have a genetic child with him. And so this is what he said here in his will. Well, Cain's 2 adult children fought to prevent Haidt from receiving his sperm. They didn't want him they didn't want her to use his sperm to have a genetic related child and their half sibling. So how did this ruling go? Well, the appellate court found in favor of Height, saying seldom has this court reviewed a probate case where the decedent evidenced his or her intent so clearly. So they said, yes, this is written consent. Clearly, we know what this person wants and we want to uphold that. She tried for several years to get pregnant using his sperm, but was never successful. And so some folks have looked at this case and said, well, the adult children were trying to stall and prevent this from happening, so that even if she did win in the end, by that point, it would be unlikely she'd be able to get pregnant due to age-related infertility. So unfortunately, a sad ending there. And this is a picture of her with Cain as a baby. Okay, I probably should have given my disclosure that I'm talking about sex explicitly here. I figure you know that we're talking about fertility. So, but responsibility for written consent. So another cartoon. I sometimes can't help myself. It's so much fun doing ethics. So who is responsible for this? Well, both ASRM and ESHRA say that clinics and storage facilities should get written consent when people are freezing their materials. So they're saying, look, it's on the clinicians and the clinics to make sure that we document their wishes. And again, this is standard of care and this usually happens, but sometimes, things can change or those documents can be old and people can change their minds. So in contrast to written consent, we have implied consent. And implied consent is based on what we know of this person, what would they have wanted done? But most people, especially young people, don't have their wishes written down. And one of the assignments I like to give to the medical students that they hate is to have them write an advance directive, to write down their wishes and go through that experience. So it can help them when they become physicians to work with their patients about their end of life wishes, where it doesn't feel as icky or taboo to talk about. In cases where we don't know someone's wishes, we rely on the proxy to use substituted judgment. And this is the case whenever we have someone who comes in who lacks capacity. We turn to the loved ones, the proxy decision maker, and say, what would your loved one want in this situation? Would they want to be intubated? Would they want this measure? Same thing when we're talking about PAR. And I think it's important to recognize, though, that there may be a conflict of interest. And so ASRM has brought this up and said, well, sometimes the only person who can come forward and tell us what the deceased wants is the one who wishes to use the deceased gametes. So is there a conflict of interest here? And the individual saying what they want, not what the deceased wants. Things like this can happen, not just for posthumous reproduction, for other things as well. But, ESHRA counters this and says, but wait a second, if the whole family and everyone is saying so-and-so would agree to this, it seems unreasonable and even cruel to require written consent if you have, even the third cousin once removed saying, oh yeah, this person totally would want this, because most people don't document their wishes. And the other thing to point out here is that just because someone has frozen material, or we're saying they were trying to conceive actively when they died, it doesn't mean that they would agree to PAR. So there's a difference between wanting to have a child while you're living and agreeing to having a child, a genetic child, when you're not going to be alive to be part of that child's life, right? So they don't necessarily go hand in hand. And over a fifth of heterosexual individuals who were undergoing IVF declined or were undecided about PAR. So these were people who are actively trying to conceive, very much want to have a child, but said, it feels a little different to conceive posthumously than it does right now when I'm planning on being alive. And a quarter of them disagreed about PAR. The couples, I don't know if they knew that before they went into this study. So what are some objections to PAR? Well, one is that, again, people may want to experience a parent-child relationship, but you don't experience that if you are deceased, right? So that's one. There's concerns about non-maleficence towards the child. Some people have brought up issues like the child may be raised in a single parent household. ESHRA and other places are saying that is not reason enough to not allow PAR. That plenty of children are raised in single parent households and do just fine. But there, is some concern about how will this child feel? Will this child feel wronged or stigmatized because they were conceived with gametes from a dead parent? There is pretty widespread support for PAR. So we see, according to some other studies, that both women and men who are undergoing ART would consent to PAR, and that 58% of women and 70% of men wanted their spouse to be able to posthumously retrieve, and use their gametes. And another study also found similar numbers here. And it's not surprising in some ways that men were more likely to say they wanted their partner to use their gametes, in part because of gender norms. Typically, we see women as the primary caregiver for children, and because, as I mentioned earlier, you have someone there who can gestate the pregnancy. And the general public actually has more favorable views on PAR than one might expect. So we see different numbers, but half to about 75% say they support PAR. So what are some of the harms? If we don't have written documentations, given all these studies I just presented and the information we have from the loved ones, is that enough to say, yes, we should move forward with something like this? Is that sufficient to meet the autonomy standard? Or do we say, this is really special in certain ways, reproduction, and we need to have clear documented evidence before we move forward with this? The question too is, can the deceased be harmed by PAR? Obviously, they're not alive anymore, so they can't be harmed in certain ways, but some have argued that PAR is a violation of autonomy if done without written consent or clear verbal consent. And so as a society here, we respect the wishes of the dead. So if I have in my will that I'm going to give you $1 million when I die, someone else can't come in and say, no, I want that money, because we look at my will and it says this is who it's going to go to. So even though I'm dead, we're still respecting my wishes, right? And some have said, as long as people are alive in the collective memory, that they're still persons and they can still be harmed. Their reputation can be harmed, right? If we learn about someone who's died and they did some horrible things during their lifetime, we might think differently about them. So there are ways in which someone could be metaphysically harmed, not physically harmed. Although that is a concern as well sometimes when we're doing certain procedures on someone who has not consented to it. Could we be violating their bodily integrity and disrespecting their body if we're doing a procedure they didn't consent to? So ESHRA believes that an opting in system is preferable to an opting out system because of the special value of autonomy in the context of reproduction. And again, this idea that reproduction is somehow special and different because it's bringing a new life into existence. It's different than saying, oh yes, my mother would want to be on antibiotics when she's in a coma, or my loved one would not want to be intubated, these sorts of things. And part of the reason ESHRA is saying this is that negative rights usually supersede positive rights. So the right not to reproduce is generally weighed more heavily than the right to reproduce. And we see this in the US legal context where there's cases of disagreements about embryos. Courts generally rule in favor of the individual who does not want that embryo to lead to a pregnancy and a child, rather than the person who wants that embryo to lead to a child. And as I mentioned just before, this violation of bodily integrity, right? We treat dead bodies with respect. We don't put them out with the recycling once a week, right? We think they are owed certain treatment. And so if PAR is requiring bodily invasion with no direct medical benefit to the deceased, this is not helping them physically, it's not going to save their life or do anything like that or make their death less painful. So there's no direct medical benefit. Maybe there's a metaphysical benefit to them. And so ASRM recognizes this and says, this may be a violation. This is an invasive procedure. And some are concerned about this because they feel like we're using someone's body as a means to an end. So we're using their body for their gametes to help someone else when we're not really, we're just kind of using them. So some people say that that's problematic. Obviously, we do similar things with organs, but organs don't have the same sort of cultural symbolism as reproduction. So let's look at some of the ethical issues that are raised by who is actually requesting PAR. And does this matter? So we could have different people requesting PAR. We could have a partner, a significant other, a parent, or a third party. So let's lay this out. Partner use. This is the one that is, most people agree, is the most ethically acceptable. And so ASRM says when we don't have written documentation, PAR is ethical only when it's a surviving spouse or life partner. ESHRA similarly says partner using PAR is the least problematic. And they could not agree, ethicists don't always agree. And they go on to say that for some members of this committee, posthumous, reproduction is only acceptable within this context. So some people said only it should be allowed when it's a partner request. And there's this idea of this joint reproductive project that couples engage in, and that it's acceptable in a partnership because this one person can continue on this reproductive project. But there's, some issues raised by that. What about single folks? ASRM says there's a less compelling case if the individual was single, and the reason for this is they don't have this joint reproductive project that the other individual can continue on without them. However, there's some concerns here about, are we reinforcing what it means to be a family? And are we relying on these heteronormative nuclear family constructions here that you have two parents and then you have a child? There can be other ways to build families with multiple parents, which is legal now in some states in the US, or multi-generational families, or families that are comprised of, aunts and uncles and neighbors and, the whole village. So are we projecting certain values about what it means to be a family when we say partner PAR is the most ethically acceptable? What about parental use of PAR? Both ASRM and ESHRA oppose parents using this for their deceased children so they can have genetically related grandchildren. And the reason they give is this idea of there's no joint reproductive project. But again, if we have different conceptions of families, we might say, but there is a reproductive project in place there. So we can talk about that more later. So I want to give an example of a case of parental request in Israel that was allowed. This was a case of a single man with cancer. He froze his sperm because he wanted to be a parent one day. When he died, his parents said the fact that he froze his sperm and that he said he wanted to be a parent is enough evidence that they would want him to use his sperm to have genetic children. And let me just tie it all the way back to the Peter Zhu case that we started with. Zhu's parents said he always told us he wanted to have many children. And so they used that as rationale for why they should be able to posthumously collect his sperm, is that he would want to have children, even if he was not there, was the argument that was made. So what was the legal ruling here? His parents wanted to donate the sperm to a single woman so that they could have a relationship with their grandchild. They wouldn't be the ones raising the child. They wanted just to have a grandchild and have a relationship with them. So in Israel, there are different laws there about sperm donation. Anonymous sperm donation is the only option. But for some women who are looking for a sperm donation, they'd rather know their donor's identity. They want to know who this person is and perhaps have a relationship with that person in some capacity. So the court in the end approved this arrangement and said this is a harmonious coming together of the interests of all parties involved. That his parents got to have a grandchildren like they wanted. The single woman got to have a genetically related child, and to know something about her sperm donor, and for her child to have a relationship with the potential grandparents. So they said this was a win-win. Let's turn to another case, this one in the US. So we had a man who was in a motorcycle accident, and his fiance asked for the hospital to retrieve his sperm since they had planned to have children together. His parents were supportive of this, but the hospital said, no, in order to do this, we need a court order. So his parents were his proxy decision makers, and they sought to get one under the Uniform Anatomical Gift Act, which is kind of a creative way of going and getting the sperm. And the judge ruled in their favor and said an anatomical gift, including the gift of sperm, can be made by the donor or by the donor's parents following the donor's death. And so this was the way they were able to get around this. And some have said, but are gametes equivalent to other organs? Should they be treated the same? Another ethical question we can talk about. There are some concern that people may be requesting PAR, as in that case and some other cases, out of grief, right? That they are emotionally devastated and they want to hold on to their loved one. And so they are saying, let me freeze their genetic material so that I can have a child one day. So ESHRA recommends waiting a year before someone actually uses frozen material. ASRM says adequate time. I don't know how long that is. But what's interesting to note is that many people who request PAR never use the frozen materials. So perhaps part of this is, a way of grieving, a way of feeling like you're still holding on to that individual, even if you never use their reproductive materials. There is some concern about the child being commemorative and that we wouldn't love the child for the child's sake, but we only love the child because the child is the genetic offspring of this person that we used to love. There's no evidence that that's the case. I mean, we don't have, clinical trials on that or anything, but what we see is that these children are usually very much wanted and loved. A lot of expense, a lot of effort has gone into creating them. And so often they are very important parts of the family. So let's look at minors and what different laws there are here, rules there are. So there is a consensus, here's another consensus, that the reproductive material of minors should be destroyed or donated to scientific research if the minors die, that we should not be able to use, no one should be able to use those materials for reproduction. And the idea here is that our reproductive material belongs to us, that it's, these are my genes, this is my genetics. And so, I should have some sort of say in this, or we should know my wishes, yet minors lack decision-making capacity as well as other rights because of their age. So, it doesn't seem right to say that what they're saying in that moment of what they would want is actually accurate, because we don't let minors make all sorts of decisions because they don't have the cognitive and intellectual maturity to do so. And the argument here is that this is too big of a decision to allow minors to make, and they might feel pressured by their parents as well. And so when parents push to have their children's gametes frozen, it's the children's future rights that they're freezing. They're freezing the right to an open future so that if the child wants to genetically reproduce later on, they can, but not so that the parents themselves have rights to those gametes. So that's an important distinction there. So third-party use of PAR, ESHRA says there's no consensus about really what to do about donation to people other than the surviving partner. They said maybe this can be justified if the person consents and we go through all the safety mechanisms. There are a lot of people out there looking for donor gametes and often don't have access to them. Could this be a solution? If people agree, perhaps. Does this raise different ethical issues? Perhaps, although we have had some sperm in storage for a long time. So, and we don't, at least in the US, always keep track of, are those donors still alive? So that could be happening. ASRM doesn't address this. So I want to wrap up there because I'd love to get your thoughts and see what you think all about this. So just to summarize what we've been talking about, so posthumous reproduction raises all sorts of justice concerns. We talk about access, cost, and the legal rights of posthumously conceived children. And we need to weigh the benefits and harms for all the folks involved here. Written consent is generally the best method for ensuring that the autonomy of the deceased is upheld, and spouse or partner request is the least ethically contentious. So if you're interested in some more, this was in one of the Oncofertility textbooks from a couple of years ago. I've written about this more. You can feel free to reach out to me. So I will stop sharing so I can take your thoughts and questions.
If anybody has a question, feel free to unmute or put it in the chat and I can read it for you. While people are thinking, Lisa, I'll just say I heard this, and I probably shouldn't repeat it because I don't know it definitively, but I had heard that the family of the West Point cadet were unsuccessful in the United States in finding a reproductive endocrinologist who was willing to use donor eggs and a surrogate, and that they had gone back to their home country, but don't know if that's accurate. Don't know what happened after that.
Okay, no, thank you for that. I heard some rumors, but I didn't know what was going on there. He was also an only child, so his parents felt extremely devastated that they had no other children. But I mean, it was a sad case, but thank you for that update. I haven't seen anything out there. If anyone else knows, feel free to share.
So there's a question in the chat. Joyce is asking, after the Caputo case, did state legislatures act to clarify?
So I should say I'm not a lawyer, so I can't answer all the legal questions, but I think after that, my understanding is after that case is that it got kicked back to the states, and the states, it was up to them to decide what to do about it. But a lot of states don't deal with this because the law hasn't really caught up to the technology. This is not, I mean, this is something that we didn't think we could do, half century ago. So I don't know what the status is on individual states, but they do, sometimes states have certain rules about this, but usually it's in the case of, you have a straight cis couple and he dies while she's pregnant. And I don't know if that always gets translated into a case of, well, we had frozen embryos, if they treat those exactly the same. So if you know more, I'd love to hear it.
I do not, but I see Dr. Patrizio has his hand up and he probably does know more.
Excellent.
Thank you so much, Lisa. I appreciate it. Very nice talk. I have a question for you. I had a training in bioethics with Arthur Kaplan. I have a master, and I have a case that I don't know honestly what to do. There is a disagreement also in the institution where I'm working right now at the University of Miami. And the case is the following: is that a gentleman died of a motorbike accident at age 27, but at age 26, he did a will. And he said, in case I die, the sperm is going to be, the use of my sperm is in the right of my father. So it then happened that he died. So then they froze the sperm, and he died when he was 27. He did the will at age 26. And now the father and his mother are asking to use the sperm, first with the donor eggs and then a surrogate. And then they were going to be taking the child, which would be the grandchild. So I had the people at the university to get together with the legal, make sure that the will was legit, the will is legit. So there is a consent that the guy wants to give the sperm to his father, the father wants to use. But now, at the end of the day, the story is that goes like this. Okay, so we as institution, we never done this for a parents asking, and therefore we will say no. So we said, no, we are going to give the sperm to wherever clinic you want. But now the father came back and said, oh, by the way, there was a girlfriend that my son had, and then she's willing now to use the sperm. And I have the right to decide, so I can decide for her. So now we are in this conundrum. What will be your thinking on this?
That's a good one. I think having some more information would help. So was this a girlfriend when he died? What was his relationship with her? What did she want? Is she feeling pressured? I don't know if you know any more
No, and that's exactly where we are stuck right now. Because we had originally planned, okay, let's say no. We never done it with the parents that is going to use an egg donation and then a surrogate and but now came back with this. So are we going to act on this? Are we going to ask to interview this potential girlfriend? Why was it never mentioned? And what are the motives behind? And I don't know how much in depth do we need to go as a reproductive specialist, professionals, into inquiring. Is the will sufficient to cover everything? Or do I still have the right to say, I'm sorry, we are not going to provide the service?
Right, and so I think, and this gets really complicated, so I'm glad you shared this case. There's a difference between, are we refusing the service or are we refusing the sperm, right? So the sperm is his. We don't quite know what the law quite doesn't know what to do with sperm. Embryos we treat as heightened property in the US, but under French law, they're juridical persons. It gets really confusing. But sperm feels different than other types of property. It's not like, oh, that's my car, I'm going to give that to my father when I die. So let's talk about whether or not we can refuse this entity, the sperm. The service we can for sure refuse. Clinicians have the right to say, I don't feel comfortable doing this, either because it's not medically indicated or because I conscientiously object. However, it gets really tricky when we're talking about reproduction and assisted reproduction, is because often the people who get told no don't meet these normative guidelines of what counts as a good family. So we see cases of lesbian couples being told, no, we're not going to do this service on you because we don't think that lesbians should have kids, right? Or single parents, or whatever the case may be. And should the clinicians really be the gatekeepers to decide who is worthy of having children and who's not, especially when other people can just go in the backseat of a car and get pregnant that way, right? Probably not the most comfortable, but what sort of metrics are we using to decide if this girlfriend is good enough and what the relationship will be? We do all sorts of things for children who exist, right? Who are in foster care or they're going up for adoption. We make sure the parents, the intended parents have a crib for them and will provide and seem relatively sane. But we don't for embryos and sperm, and so I wish I could give you the easy answer. I feel like just a stereotypical.
It's a tough one, also because never showed up in the picture, this girlfriend, until now when they find out, okay, we are not providing service because blah, blah, blah. Oh, no, there was a girlfriend. And the question also is, if we do have this girlfriend in the picture, the girlfriend is going to be the one that is going to deliver and is going to have the child. So it's not going to be giving this child to the father and the mother to have their grandchild to remember the son that they lost. It's a kind of very complex.
Right, and she's legally the parent, and who is she going to put legally on the birth certificate as the father? What is their relationship? Will they have? Yeah, it gets really, really messy. This is when I like to bring in the whole ethics team and social work and psychology and everyone.
Kenneth Goodman here in Miami, he's totally against and says, no, Pasquale, let's not do it. That's okay. Thank you so much.
No, thank you. Good case.
Anybody else?
Yeah.
Go ahead, Amani.
My question is, so as you were saying that last part about who can be on the birth certificate, so anyone who is deceased cannot be on a birth certificate if it's. Hello?
Oh, there you are. You broke up for a second on my end.
Oh, sorry. My question just was, so anyone who is deceased cannot be listed as a birth parent at the time of.
That they can't be listed. So I don't know all the state by state laws. I think that's what some folks have been trying to do when they get survivor benefits for children, like the Caputo case that we talked about. But again, I think but if you know the law, you probably know the law better than I do. So
I see. So it's state by state. So she was probably able to write down his name.
Yeah, that's my understanding. Again, lawyers on the call, please correct me if I'm wrong.
Interesting. Thank you.
Yeah, thanks. Nice to see you.
Hey, Lisa, thanks for a great talk as usual. You know, one thing that I feel like we hear about these cases is that, you know, you describe so many different scenarios, but then there's oftentimes the wrench of what if everyone agrees and the court grants, you know, the PAR, but then what if there's a complication in the pregnancy, or, you know, what if there's some testing that shows that there is an abnormality? And then do you have some insight into how those decisions get made? Because I've heard of these cases where it just gets even more complicated.
Yeah, no, that's tricky. Good question. Because, right, if there was some sort of fetal abnormality, and we know that the genetic parent would not have wanted a child, you know, would have felt horribly guilty passing along a certain condition that they have that might be genetic. Blah, blah, blah. Legally, I think the answer is the legal parent makes those decisions. Ethically, I would hope that they would take into consideration what the other person would have wanted, just like they would in how they raise the child. So are they going to raise this child in a certain religious faith? Are they going to make sure this, you know, kid is a soccer player? All those sorts of things. But legally, I think it just goes to the legal parent.
But, you know, sometimes if there is a deceased person who had the donor sperm, and then like an egg donor, and then a surrogate, and then like somebody else is potentially going to raise the child, and, you know, it becomes really messy, like even messier than it already started to be.
Yeah, no, it totally is. And you probably know that case where a surrogate was asked, you know, she signed her contract with the intended parents to say, if the fetus has certain conditions, I will abort. And she agreed. And then it turned out the fetus did have those conditions, and she refused to abort. And she fled to Michigan, which is very hostile to.
I was thinking about that.
Yeah. And so the child was born, and legally she was the parent there, even though she was the gestational parent, not the genetic parent or the intended parent. And then the genetic parents are trying to get rights back to the kid. And I mean, this is, it's a mess. I don't know what the easy answer is, and I don't think our legal system is constructed on how to deal with this. And I feel like we're just always playing catch up with these sorts of issues.
Yeah, because it's like the decision. I think you focus a lot on that decision about whether or not to allow that part to happen, but then that might be like the first of multiple decisions that then come down the road.
Yeah. So I guess the best thing I could say is maybe document all your wishes, but I don't think many healthy, you know, young people are going to say, like, in case I die and someone else gets pregnant and there's this condition, and like, I mean, it's not possible.
You know, but it brings up an interesting point, because as more people are potentially, or more women are potentially doing planned oocyte freezing, I'm wondering if clinics are suggesting or recommending that they have within that contract what will happen in the event of their death. I don't know the answer, but I'm wondering.
Do other clinicians, I mean, I'm thinking they're putting that in there, but I don't know how extensive it is and how detailed, right? I don't know if there's clinicians on the call who want to respond to that.
In Australia, I'll just come in Australia, it is in the consent form, but there aren't a lot of options available. So from my understanding, and it varies state by state here as well, but in my state, I think women who do planned oocyte cryopreservation can either say that in the event of their death, donate to research or discard.
Okay, thank you.
Yeah, and in the States, if people use ReproTech, then those consent forms are very clear about the wishes of what should be done in the event of, you know, something happening to that person, and they can discard or donate to someone. And then for minors, they only allow for the options of discarding.
Okay.
Someone wrote, Eileen wrote, this is the part of the consent at the fertility clinic where I work in Toronto, Canada, and the same as what Michelle said, that they can donate to research or discard. but can donate to a spouse if they have one.
So they can't just donate to a sperm bank or something like that,
Yeah, sounds like.
or their neighbor or whoever. Yeah.
Yeah, or a sister or brother. I've known of many instances, probably more so, of people who wanting, like someone, a cancer patient that we once talked to, her brother was gay and she had cancer, and she said, I wrote a will that said he can have my eggs and my embryos, but whether or not that will be respected is hard to say.
Right. And again, this goes back to the idea of like, what should count as a family and who should be making those decisions? Because is it fair that we have people who are in these vulnerable positions who are dying or facing cancer or something like that, who are freezing their materials, and we're giving them a different set of rules about how they can reproduce and with whom they can reproduce, and folks, again, who are just doing it through heterosexual intercourse?
Yeah. And Eileen further added, in Canada, that they can put in their will for a court order, but it's not possible in a fertility consent due to the Assisted Human Reproduction Act.
Yeah, interesting. And this is, the US is somewhat of an anomaly when it comes to how we handle sperm and eggs, that we treat them like they're commodities that we can buy and sell them. Most other Western countries don't allow that. Same thing with, gestational surrogacy. It's a patchwork of laws throughout the states, whereas in many other Western countries, it is not allowed. So, my comment earlier about being like the Wild West is we are more permissible with certain things, which is both good and bad. Like, we want to support reproductive liberty, except for maybe I won't say anything too political what's happening in Texas right now, but in certain ways we want to support reproductive liberty. But, sometimes we need to have some regulations in place to protect folks.
I think, Vanya, I think you've told me in the past that it's absolutely not permitted in Portugal. So under any kind of circumstance.
Do you listen?
Yes, we can hear you.
Okay. No, here, as far as I know, it's not allowed to do it. So I don't know actually much details, since it's not much talked.
Yeah, and I wonder, Mahmoud, if you're still on, since I know you've done a lot of work in medical tourism, if this may be some of the reasons why people might be traveling to do things, because like potentially the parents of this West Point cadet, if no one in the country that they're living in will let them do what they want, can they go someplace else?
Yeah, according to my knowledge, for reproductive tourism or cross-border reproductive care, it was not listed among the services that patients can travel to get, but maybe in the future. And it depends also on the legal situation in the country that provides these treatments. But yeah, to my knowledge, till now, it is not on the list of the services or reproductive service provided through the cross-border reproductive care.
And James Klosky is saying that in pediatrics, where he is in, sometimes run into problems when the consent is completed, but the patient is a minor, but then it's not upgraded or updated once they become a legal adult. So if the patient passes away in adulthood, then their adult wishes are less clear.
Yeah, right. And, often if you're 18 or 19, you're not necessarily thinking about reproducing. So they may not be updating that. That's challenging.
I think we've seen that in our own clinic here. Amani and I have been working on contacting people who banked gametes, as a minor. And the clinic just, it's so much work involved in calling people or emailing and saying, hey, 5 years have passed and now you're an adult, and do you want to come back in and sign this? So I imagine most clinics just don't have the person power to do that.
Right. And we see that there's just already so many frozen materials left abandoned. So what do we do with that? What obligation do we have? What if the minor didn't realize there was, that they had to come back, or because they didn't realize this was done because their parents did it when they were children. It can get really complicated.
Certainly that could be the case with ovarian tissue where, people were under the age of 7 and have no memory.
Right.
Does anybody else have any comments, thoughts they want to share? Well, I thank you very much, Lisa, for your time. This is really, I don't know, there's a weird echo. They're very interesting conversation. And if anybody wants to follow up with you, I don't know if you feel comfortable sharing your email, that they can ask you questions in that way. So thank you everybody for joining in. This was a great presentation. And I really enjoyed it. And it's just so interesting how this is a very fluid conversation because things are changing, around these laws and case precedent studies, on a monthly basis.
Yeah. Thank you all so much, and feel free to reach out. Appreciate it. Thanks for your good conversation.
Bye.
Thank you. Bye-bye.